and are simplified. Bloody diarrhea bugs. Organism, key features. Campylobacter jejuni, comma or S-shaped bacteria, grows at 42 degrees from undercooked chicken. Entamoeba histolytica, protozoa, causes amoebic dysentery and liver abscesses, flask-shaped ulcers. Enterohemorrhagic E. coli, O157H7 strain, Shiga toxin, causes U.S. kidney failure, undercooked beef. Enteroinvasive E. coli invades colonic mucosa, similar to Shigella, bloody diarrhea. Salmonella non-typhoidal, lactose-negative motile from poultry eggs can enter bloodstream. Shigella, lactose-negative non-motile. Very low ID50, Shiga toxin, human-only spread. Yersinia enterocolitica, from pork milk or daycare, mimics appendicitis, can cause bloody diarrhea. USMLE-style questions, 1 per pathogen. 1. Campylobacter jejuni. Question. A 24-year-old man presents with fever, abdominal cramping, and bloody diarrhea 3 days after eating grilled chicken. Stool culture shows curved, gram-negative rods that grow at 42 degrees G Celsius. What is the most likely organism? A. Shigella flexneri. B. Salmonella enterica. C. Escherichia coli, O157H7. D. Campylobacter jejuni. E. Clostridium difficile. Why not others? A. Shigella doesn't grow at 42 degrees C. B. Salmonella isn't curved. C. EHEC doesn't grow well at 42 degrees C. E. C. difficile causes watery diarrhea, not bloody. 2. Entamoeba histolytica. Question. A 30-year-old traveler returns from Mexico with fever, abdominal pain, and bloody diarrhea. Imaging reveals a liver abscess. Colonoscopy shows flask-shaped ulcers. What is the most likely cause? A. Salmonella typhi. B. Giardia lamblia. C. Entamoeba histolytica. D. Shigella sonnei. E. Cryptosporidium parvum. Answer C. Entamoeba histolytica. Why not others? A. Typhoid fever has constipation, not liver abscess. B. Giardia causes fatty diarrhea, no blood or liver lesions. D. Shigella doesn't cause liver abscesses. E. Cryptosporidium causes watery diarrhea in AIDS, not blood or liver issues. Enterohemorrhagic E. coli, EHEC C. Question. A 6-year-old girl develops bloody diarrhea after eating undercooked hamburger. A few days later, she shows signs of anemia, thrombocytopenia, and acute kidney injury. What is the likely organism? A. Campylobacter jejuni. B. Enterotoxigenic E. coli. C. Shigella flexneri. D. Enterohemorrhagic E. coli. E. Salmonella enterica. Answer. Why not others? A. No US association. B. Causes watery, not bloody diarrhea. C. May cause dysentery, but US less common. E. Can be invasive, but not usually associated with US. 4. Enteroinvasive E. coli. Question. A 35-year-old man presents with fever and bloody diarrhea. Stool cultures show gram-negative rods that invade intestinal epithelial cells but do not produce toxins. What is the most likely cause? A. Shigella flexneri. B. Campylobacter jejuni. C. Enteroinvasive E. coli. D. Salmonella typhi. E. Enterotoxigenic E. coli. Answer C. Enteroinvasive. Why not others? A. Shigella is toxin-producing. B. Not typically invasive at the cellular level. Typhoid fever causes systemic symptoms and constipation. E. Causes watery diarrhea, not invasive. 5. Salmonella non-typhoidal. Question. A 40-year-old man develops bloody diarrhea after eating raw eggs. Stool cultures reveal gram-negative, lactose-negative motile rods. Which organism is responsible? A. Shigella dysenteria. B. Salmonella enterica. C. Escherichia coli, O157H7. D. Campylobacter jejuni. E. Yersinia enterocolitica. Answer B. Salmonella enterica. Why not others? A. Shigella is non-motile. C. EHEC doesn't swim, not linked to eggs. D. Not associated with eggs. E. Usually from pork daycare. Question. A 4-year-old boy in daycare presents with fever and bloody diarrhea. Stool cultures show gram-negative rods that do not ferment lactose and are non-motile. Which is most likely? A. Salmonella typhi. B. Escherichia coli, O157H7. C. Shigella sonnei. D. Campylobacter jejuni. E. Yersinia enterocolitica. Answer. C. Shigella sonnei. Why not others? Typhi doesn't typically cause bloody diarrhea. B. EHEC is motile. D. Curved shape, motile. E. Usually pseudoappendicitis, not primary bloody diarrhea. 7. Yersinia enterocolitica. Question. A 10-year-old boy presents with fever, abdominal pain in the right lower quadrant, and bloody diarrhea. His symptoms mimic appendicitis. His younger sibling recently had diarrhea after drinking unpasteurized milk. Which organism is likely? A. Escherichia coli O157H7, B. Campylobacter jejuni, C. Yersinia enterocolitica, D. Entamoeba histolytica. E. Answer: C. Yersinia enterocolitica. Why not others? A. Causes HUS, not pseudoappendicitis. No strong association with RLQ pain mimic. D. Not related to dairy or RLQ pain. E. Doesn't mimic appendicitis. Let me know if you want a chart